Ladies and gentlemen, after Dr. Stephen Grogmeyer gave us that very inspirational talk, we are now going to dive deep into a panel discussion. I love the fact that we have opportunities and challenges as part of this title, because I feel like this really is a theme throughout the entire programming here for the 3 days. We do, of course, look at the challenges. What are some of the problems and issues, the most timely and topical issues that we need to address? And then we really are taking an optimistic look at the opportunities. This particular focus is a revenue cycle management in the digital age. And I should say, on a digital point, we have an audience joining us online, as well as our wonderful audience here at ADNEC. So, may I please invite on stage M42's Senior Manager of Payer Affairs. He is Dr. Mutaz Ahmed, and he's going to be your moderator. Dr. Mutaz, please come on stage. Dr. Mutaz, you have a wonderful cast list. And between us, let's ensure that we give them a big announcement. So I'm going to go for Dr. Ali Yanez, who is the Executive VP of Group Revenue Cycle and Regulatory Affairs at M42. Dr. Michael Bitzer, the Senior Advisor and Investor at Wiser Venture Capital and former CEO of Damam. And we have Anas Batika, who is the founder and CEO of Santecture, to join us as our final and wonderful panelists for this discussion. Over to yourself, Dr. Mutaz.
Thank you. Good afternoon, everyone, and thank you for joining us today. We will be discussing today the revenue cycle management in digital age, and we will be exploring opportunities and challenges. Please write down your questions at the end of the session. This panel discussion will explore the opportunities and challenges of revenue cycle management in the digital age and discuss strategies of optimizing revenue cycle operations in rapidly evolving healthcare landscape and how this will contribute to payers and regulators targeting a sustainable healthcare ecosystem. I would start with Dr. Michael. Throughout your experience in the payer side and as a leader in health insurance, founding the health insurance schema in Emirate of Abu Dhabi through your former role as CEO of Daman. How does the tech-enabled structure and processes impacting in the speed and accuracy of the claim cycle? And how this would affect on the insurance policies and premium and underwriting?
But let me first start with a big thank you. For me, first time on stage in Abu Dhabi. Since I left Abu Dhabi, we announced it yesterday on LinkedIn and got so many direct messages, so many faces, visitors, so thank you very much. That's just what I didn't want to forget. I'm not digital native, and some might ask, okay, what can you say about AI? I'm also a senior advisor to a company called Applied Artificial Intelligence Company, so I'm a bit involved in the topic. And now before answering the question of the impact on underwriting and pricing, let me start a bit with the process. I cannot talk too much because Dr. Ali will cover it, but not everyone is familiar with it. All the hospitals here have an army of people producing claims. Some of the companies here around have 400 or 500 people only producing claims. The insurers have hundreds of people reviewing these claims, and this costs a hell of a money. And it's, I would say, abuse of resources, because we are very often nurses and doctors, and they should work in hospitals. We have a shortage. And AI helps us now to optimize these processes. I think Dr. Ali will cover the revenue side. Let me talk about the insurance part. Insurance companies receive claims, and in the past they reviewed all manually. They already introduced 10, 15 years ago rule engines, machine learning, so there is already a level of optimization on the side of the insurance companies. But what does it mean? And that was the question for underwriting and pricing. First, underwriting is risk assessment. For the underwriting, you have to separate between markets and countries where you have mandatory products, which every citizen has to have. There is no underwriting. That's in Abu Dhabi with basic product, for example. Otherwise, you have group underwriting, individual underwriting, but here the faster claims process does not really help because you assess the risk before you have a claim. But the better automated claims processing helps in the pricing. And here you have to understand the cycle. If an insurance policy runs 1 year, then let's say it starts in January, then you discuss with a client in August the pricing for the new year. And in August you have maybe just claims of 2 months in your system. And with 2 months claims, your actuaries have to calculate the potential full year cost, and then you have to give the client a price. And if you talk about price in group policies, you talk about policies of 300, 400, 500 million value. And if you do there a 1% mistake, then you simply lose 4 or 5 million bottom line. And if the claims processing is faster and you gain, for example, 2 months, then you have maybe in August already the claims of 40% of the year in the system, and you're in a much better position for proper and accurate pricing. That's not only important for the insurance companies to maximize revenues, that's also important for the client because the client wants a fair price, really reflecting the risk. So it helps insurers tremendously, saving operational costs by easier review, but especially the better pricing and underwriting.
Thank you, Dr. Michael, for the insightful information. And building on those information, Anas, considering your great exposure to the payer and provider revenue cycle processes, building a digital solutions for helping them to improve their processes. So as the healthcare ecosystem become more mature, there is a need for a reimbursement model that reflects the value of care. So from your experience, how do you think the digital and innovation can support the value-based reimbursement?
Thank you, Dr. Matez, and thank you, Dr. Michael. Basically, value-based healthcare is driven by, obviously, access to healthcare, good healthcare. It's driven by cost and the outcomes. Now, if we're talking about the cost element, there's no reason why the insurance claim has to be managed on the payer side. It can start to be managed on the provider side. Before even the patient leaves the hospital, we should know what benefits they have, what's included or not included in their coverage and policy, and determine the cost of that visit way ahead of the time that you need to send that claim over to the payer. So we're talking here about a connected system where payer, provider, and regulator, to that matter, is all exchanging data in real time. And the management and the burden of the management of that policy and the patient benefits should really sit with the provider that should not be surprised of a certain extra cost on them in terms of denial, having provided the service, having delivered the healthcare to the patient, not to be reimbursed for it. Adding to that, what Dr. Michael alluded to is the reducing the bottom line cost. So technology is here to basically help us reduce that wastage in terms of resources that are actually doing a lot of manual tasks that technology is more than capable of handling them. Healthcare is one of those sectors that have a lot of unstructured data. It's maybe the largest in terms of unstructured data. Technology is now helping us structuring this data, using that data, predicting the future of either outcomes in terms of clinical or even in terms of reimbursement. So we should be using that knowledge way upstream on the provider side to reduce the cost and also to deliver the right benefits and the right healthcare at the right time.
Thank you, Anas. And Dr. Ali, building on what Anas said and considering the effectiveness of the processes in the operation and financial aspect, and from your experience, your exposure into the payers and providers, operational processes, workflows. So what impact does an AI-enabled revenue cycle platform have on processes, especially on large network providers like M42? How do you see it?
Thank you, Dr. Matez, and thank you for colleagues. Actually, the whole topic is dear to my heart. I was lucky to be part of Taman when we started in 2009 and 10, the first steps of trying to automate, building neural engines. Then we moved to machine learning, and we ended in artificial intelligence in a component. But reality about the value of artificial intelligence comes from understanding what's revenue cycle is doing. So it's a heavy FTE process where we have humans having working hours, having availability, capacity, where we're talking about targets. Their accuracy level is not reported in a structured way because we get the feedback from the employees themselves. So the value of this AI today, it will have a cost effectiveness impact. It might reach to a very high number. I'll share our experience in a minute. Second, it increases the accuracy. And then it has a faster processing time. We don't need to wait 60 days or 40 days as per the contract to submit our claims. The rules in the system says you submit earlier, you get paid earlier. Now, we at M42 proud to announce that we have adopted an AI model. First pilot is successful. Really very happy with the outcome we received. Maybe it might save 50% of our task force off coding process. We started other coding. And from a value perspective to a group, it is more of the learning curve of what was going wrong, how this can be structured in an effective feedback that can learn and we learn. Because human processes, usually you can't fix it easy. But when it's a machine or a system-based, like AI, you understand what is the mistake. So the vicious cycle of submitting a wrong claim, a wrong data, then followed by a rejection, then a resubmission, this is really a waste of time for both the payer and the provider. Moreover, it's the accuracy of the claim itself, it's become higher because we have a processor doing outpatient here, outpatient here. As a group, we have almost 40 providers, and we cannot really make it seamless and consistent unless we have a system to control that. So the learning curve is across even for the other processes we do, in addition to the accuracy, as I mentioned. And I think from the experience we have so far in the last 6 months, we are very happy of the outcome. And I think it's an experience that must go to the whole market to benefit from.
Thank you, Dr. Ali. You nailed the opportunities and the challenges. Yes, there is an opportunity, but the challenges need to be addressed very well. Dr. Michael, building on Dr. Ali's thought on the opportunities and challenges of digital innovation, how do you see the digital innovation engagement in the future within the revenue cycle management, or let me say it, within the claim cycle perspective?
Easy and difficult question. I say the current process will, in my view, be fully automated in a few years. There will be maybe a few people supervising computers, managing the interaction between an insurance company and a healthcare provider. But that's based on the current traditional model of DRGs and CPTs. But let's face it, this means we are automating a rubbish system because DRGs, CPTs have a history, but at the end, nowhere in the world people are happy because it just encourages treatment and treating sick people and getting money. There's no valuation of prevention. Nobody really cares about the outcome. So we need to use digitalization in the future to completely change the system. And maybe one day we have only a payment linked to the health of a patient. Maybe one day you all have a tracker and it's measured, how are you feeling, and then the provider is paid in this way. That's maybe a bit too far in the future, but the current system leads nowhere. In the US we are spending, and I'm talking about US because a lot we are doing here is copied from the US, we are spending 17% of GDP for healthcare, and life expectancy is 76, went down after Corona like everywhere in the world, but it's recovering slower. I had last 1.5 years, 50% of my time I spent in Estonia. Estonia is spending 6% of GDP and life expectancy is 76. And so costs go up and up. Everybody talks in every presentation about what they are doing great for the patients, but let's face it, and I'm neutral so I can talk whatever I want. At the end, everybody looks for revenues. So we need to completely change the system and pay for, I don't like this pay for value because that's a bit a buzzword and every consulting company tries to sell a project, but we need to pay for outcome, for well-being, for health. So as I said, in a summary, the current system will be automated probably 100% in a few years. But all of us, we regulators need to consider completely new payment systems.
Cross fingers. We're all wishing to reach to this maturity one day where the digital innovation works very efficient and very accurate. And this will take me, Anas, to the next question. How do you see the viability of the digital innovation that is currently happening within the RCM environment? How do you see the viability by itself?
I mean, we support our clients in that particular domain and space, and we're seeing a lot more adoption. We're seeing more, clients taking more active steps towards trying, as the case with Dr. Ali Anis earlier. POC is important. You know, it's emerging technologies, is something new that you need to try and see whether it works for you. And while everyone is talking AI, implementations of it vary a lot. And how you implement it is not just one solution that fits all. The data is not the same from one facility to another. The needs and where the pressing, urgent issues are different from one environment to another. So we work with more than 70 healthcare facilities across the region, not just in the UAE. And I've never seen one environment, we've never done a copy-paste from one environment to another. But the key message here is that, yes, technology is entering more and more into the administrative side of healthcare because there's a big need in that space. I think with the AI penetrating on the clinical, that's well documented and is getting much more good results. The admin side of it is rapidly expanding as of.
Thank you, Anas. You are very optimistic. Opportunities more than challenges. I will take these thoughts to Dr. Ali. And I know you have a very clear vision and clear insights about how things can go. So I will put it very straightforward. How do you see the future of RCM? Let's call in 10 years. How do you see the future of RCM with this digitalization onboarded?
Short answer is bright, definitely. Future is very bright. Just want to to answer a question first before I comment on Dr. Michael's point. Definitely the adoption of AI currently is maybe in one area of a cycle because we have phases in each cycle and each processes. But I see the future, AI is everywhere, from A to Z. Currently at M42 we have many modules which touch on the clinical documentation itself, moving from it to the physician. It's a seamless process where end up to the billing. So the future, I mean, as a vision for the RCM as partnership with the payers, I feel that, or I expect the future to be patient going out of the clinic and the claims is at the payer side. And that's then we'll have a seamless process and we leave the provider and the payer to focus on the more important things that contribute to the health and the wellness of the patient rather than thinking what I'm getting to reimburse. And I agree with Dr. Michael, maybe the future will be in a different payment model. Maybe it's a value-based reimbursement or it's a more of a prevention and well-being point because we are looking for a healthy population. But I believe all the markets should think seriously about going AI everywhere. And I see the audience is a mix of a payer and providers, my ex-colleagues, my friends. So I think the future is AI across.
Thank you so much, Dr. Ali. And I'm very enthusiastic about the optimistic view of our panelists, and I'll take the mic to our audience. I'll see if there is any question that you would like to ask our panelists before we close the session. Okay, so thank you. The future is bright. We will look forward into more digitalization in our work and more decision making rather than processing only. Thank you so much. Thank you, Dr. Michael, Anas, Dr. Ali. and looking forward to moderate other sessions with you in the future. Thank you so much. Thank you.
Fantastic. I'm just going to make sure you get your wonderful photograph. Ladies and gentlemen, give them another big round of applause. Thank you so much. And we will set the stage for the next session momentarily.